for joining another episode of Black Gay Table Talk. Welcome to our fourth season. Congratulations to us. Yay! So, today joining us, we have the amazing pleasure of welcoming the award winning CEO and founder of Wellness Homes of Chicago and Wellness Homes Behavioral Health
Mm,
Services. He's amazing. He's a true ambassador for the Black LGBT community, LGBTQIA community.
get it right.
Um,
Mhm.
right, get it right. So we have Dr. Maurice Brownlee, aka Dr. Mo. Dr. Mo, how are you?
I'm great. You know what? I am so thrilled and so honored to be on the revamping of your show. So I'm just ready to talk and let the listeners know what we're doing in the community and just giving them heads up. This is our time. This is our moment.
This is our moment. I love that.
Mhm.
So, for those viewers or listeners that aren't familiar with you yet, tell us a bit about your background.
Yeah.
Oh,
So I'm from Georgia. And if I talk long enough, you'll hear it. I said Finn, going and all that other good stuff. I moved to Chicago about 9, 10 years ago to study with my mentor, Dr. Daniel Berger. I graduated from Duke University in a HIV program. And people said, well, why did you move to Chicago when, Atlanta is so hot right now with HIV? Well,
mm,
sometimes sometimes you gotta move away from home. And Jesus wasn't he didn't do all his miracles in his hometown. And so I had to understand that. The other part, Kenan, that I had to get was and it's kind of crazy, right? I remember going through clinical rotations and every room I went in, I would see my friends. And I did
mm,
not know that they were positive or they had a diagnosis, and it became very uncomfortable. And so I immediately changed my clinical rotation and I moved to Chicago because it just became very uncomfortable for me at that time. But it was one of the best moves I ever made. Um,
mm-hmm,
when I got to Chicago, the next question was, why did you decide to go on the north side of town versus the south side of town? Well, what
mm-hmm.
people don't realize is health disparity is health disparity. We all are dealing with something, Kenny. We all are dealing with something. And so
This is true.
health disparity don't look the same, but it is something. So one of the things I had to do was I had to buckle down and get it so that I can take it back to my community. And so, I had to get that knowledge. And so, I did that. And so that's
Got
how
it.
we were born. The Wellness Home of Chicago
Got
was
it.
born.
I love that. So, and you tapped on this a bit. So, if you could dive a bit deeper for me, what were some observations or additional experiences that you saw or that you had that made you want to hone in or focus more on the Black and Brown community?
Yeah, yeah. Well, originally, I mean, I was already a CEO of an organization when I decided to
Hmm.
go back to school. So I went back to school as an adult. But what I found was in Atlanta, there were just so many patients that was just entering into care, and they had defined AIDS at that point. And I just knew it just had to be something that could prevent that. And so I applied and went back to school. Coming to Chicago, um, you know, it's a different type of need.
Hmm.
There is more disparity when we talk about our Black and Brown community, and it's a more of a lack of knowledge, right? I don't care what people say about Illinois, about Chicago. I can tell you the healthcare system is just a tad bit better. And when I say that, let me just explain what I mean by that.
Hmm.
Um, you can go to a clinic and get service, and you can do the same in Atlanta. However, the stigma is just a little bit more deeper in Atlanta. That is what I found. Um, Not that it's not here, but it's just a little bit more deeper there because of the community being so large. That is, here it's a different flavor. You can go and get help, and see housing happening for people who have HIV and AIDS and so on and so forth. I didn't see a whole lot of that. And not that it wasn't happening, it's just that it was more prominent, and it is more prominent here. Obviously, the HIV
Yeah.
rates are not as high as they are in Georgia, um,
Hmm.
in those southern states, because the state of Illinois is doing a pretty decent job. Um, we can do better, like all things. We can do better,
We can do
uh,
better.
but
Yeah.
but in terms of being on the map for HIV, we're not as high as some other states. I gotta
Hmm.
preface that though, Ken, and I have to say that again. It's not that it's not an issue. We definitely can do better. But when we talk about the Midwest compared to the southern states, we're not as high. And the reason why, one of the reason why, is that the health disparity is just a little bit, worse in the southern states. And not that it doesn't exist here.
Right. You know what? It makes total sense. And I have to say, before I moved to the Chicagoland area, well, I'm originally from Memphis, Memphis,
Hmm.
Tennessee.
Hmm.
And that was one of the first things that I noticed. Not to say that there weren't, programs available, having that education about the programs, we didn't see a lot. Like there were, oh gosh, a number of things that I noticed once we moved here. Like, oh wow, I wonder if they did that back in Tennessee. I wonder if they did that in Memphis,
Uh-huh.
And
Uh-huh.
over time, some things I did see they were offered, probably not at the scale that they're offered, here, but they were offered, or it was something that they were, waiting on funding for, something to that effect.
Yeah. Yeah.
But I did notice there is a stark difference
Yeah.
between being more up north and
Yeah.
down south.
Yeah.
Yeah.
You just hit the nail on the head, and that is access. And that is, maybe the Midwest states do a great job of getting the message out, whereas in the
Mm,
southern states, they didn't do that well of a job with getting the message out. And so that's a very key point. We're getting ready to do some research, so I'm glad you told me about that, because that is a key point. What makes it different, right? Are you able
yeah.
to get the
Yeah.
message to the people who need it the most, right?
Yeah.
So why is it that we come to the Midwest and we're so much more knowledgeable than we were when we were living in the South? That's
Yeah.
that's that's wow, right?
It's wild. I'm kind of I want to bite my tongue on this a bit, but I'll go ahead and say it. I remember being there, and we've been here going it's almost been 12 years now. But you have that religion that people will sometimes say kind of runs things in the city of Memphis. So I feel like sometimes those messages can be stifled a bit
Mm, yeah,
because of the
Bible Belt.
religious influence. Yes.
Yeah,
I have to say it. I think that that might have been one of the reasons why,
yeah,
looking back. But nevertheless, I think things have gotten better and they're going to continue to get better, especially when we have that, like you navigated up north. I'm sure there are some things that you've learned along the way, some things that you've implemented or plan on implementing that could be an example for those, in the South.
yeah. So you're right. Sometimes you just got to move away in order to go back, right? And
You
so
have to move away. Yeah.
everything that I am doing now, I do hope and pray that I can replicate to take to the southern states, because there is such a need. I don't need to tell you that. If you look, saw the last numbers that were published, you see some of the cities that were once number five are now number one with HIV prevalence. And so there's a lot of work to do. And
Yeah.
there are people who are doing work in those states. There's no doubt
Sure.
about that. There are people who are doing work. You know what I think? And I think that, it's just finding that model of care, that model of care that's going to welcome this very, very unique patient population, so that you can cut down the stigma, you can break through the Bible, the scriptures, and all that other great stuff, and you can let people feel welcome with coming in. And so
Yes.
it's going to take a village to make that happen. But I do think
Mhm.
that when we talk about how you get that conversation started, it is looking at the model of care. One of the things that we do here at the Wellness Home is that we do break down that, we don't like to institutionalize care at all. I don't want anything that I own to look like a clinic. I don't want it to look
Mm,
like a clinic. I want it to feel like a home. And I want the people to be at the front desk to be your auntie, you know,
right.
your grandmama, your granddaddy. I mean, that's what I want. And I
I
want
love
you to
that.
feel welcome. And so I don't put cold chairs in my waiting room. I don't, have that atmosphere because I do want you to feel welcome when you come. And so when we talk about, all right, how do we break down these barriers? How do we get people to be engaged into their care? I've said this for years and I continue to say it. It is, we got to look at that model of care, and we got to be willing to make a model of care where everybody can get care, regardless of what they look like, regardless of
Yes,
who they go with in their bedroom. We got to do that.
I love that. I'm notorious for saying you're gonna make me run through this room.
Uh-huh.
So I love it. I
Yeah,
love it.
yeah,
So, um, you know what? We tapped into this, and this kind of leads me into my next piece, innovation, right? But before we get there, what's an overview, a healthy overview of what is offered at the organization or
yeah,
in your
yeah.
offices?
So, Wellness Home of Chicago is what we call an integrated healthcare organization. And so when you think about integration, think about this, is that we want to be able to provide a spot to where you can get all of your services. And you don't have to go and come back, go and come back. So we offer behavioral health. We offer weight loss. We offer primary care. We offer immediate care. Inside of our practices, we do IV therapy. We do nutritional IVs. We do ketamine therapy. We do
Mm,
TMS. For those of you that don't know what TMS is transcranial magnetic stimulation for people who have resistant depression.
wow.
You and I spoke a little bit before the show. We are beginning to offer more neurobehavioral health services. And what that is, it's just realizing that people have trauma. It's realizing that people are traumatized, and you're finding a way to manage their depression, to manage their OCD without
Mm-hmm.
medication. And so
Hmm.
we do that, and we do it very well, I have to say. One of the things, Kenan, I don't believe in, I don't ever put my patients, particularly my patients of color, on any psychotropic medication without doing a genotype test. Um, I want to
Wow,
know,
that's important.
I want to, yeah, right. I want to know that the medication that I put you on is going to be acceptable to your genes, to your phenotype. So I make sure that before we talk about meds, that I've done this test. And so that's the innovative stuff that we're doing. And I have to say, we're probably not the only ones that are doing it, but we're doing it in a different manner. And so, one of the other things that we're doing is that we are being accessible, right? How many times have you ever identified that your doctor's office or where you go to get care is only open from 9 a.m. to 4 in the afternoon, Monday through Friday? I'm
Hmm.
not proud to say this, but I work 7 days a week right now, and we are open 7 days a week. And you gotta make these things accessible. And so when we talk about what that model of care looks like, you just said, there's no way I can ask a patient who works at McDonald's who's HIV positive to miss a day from work. I can't do
Mm-hmm.
that. Why not create a model where that patient can come in the evening time or even come on the weekend to get care? And so on Sundays, I call them church Sundays, we see over 90 patients on Sundays.
Wow.
And that's really amazing, to have that many patients inside of one of our wellness homes.
Yes.
And I do something very non-traditional. I play music. I play music. I have my church sisters who are coming after church. If we have food, we invite everybody to eat with us. That's just what we do.
Wow.
I mean, that's just what we
I
do.
love
It's,
that.
it's awesome. Yeah.
It's like you're at home. It's
It's
like you're at home.
There you go.
Wow. From the furniture to the staff to the
Hmm.
environment, like it gives home. It gives
Hmm.
this is a safe space.
Safe space. You got it.
I love that. Wow. Wow, that's innovation.
Yep.
And not to mention, you've won Health Innovator Award.
Yeah. Yep. Yep. For
So what was that about?
2024. Yeah, I did.
2024.
Yeah, yeah, for this model of care. It's an honor to have won that award. So I am very proud of that award. It's the Health Innovators Award from the Boston Public Health Association. And so, they recognize the work that I do, and I'm very thrilled to have received, to be a recipient of that award.
Yes, that's amazing. And it's amazing for us individuals like myself who look for those innovators, those people who are movers and shakers to really be given those flowers. And I see it happening a lot more now. So I'm very happy that you were able to receive or be a recipient for that award because you definitely deserve it. You do.
I appreciate it.
Now, let me ask you, how do you manage to either incorporate or keep the cultural competency and sensitivity in your health programs?
Yeah, yeah. You have to teach it. I mean, you gotta keep teaching it. You got to make sure that it's in the culture of
Hmm.
um, your every being.
Hmm.
One of the things that we do is, we pray. We have a huddle and we pray. That is in the culture. And so when we talk about being sensitive, we are sensitive to those that don't pray, right? And we are sensitive to those don't look like us. And we teach that sensitivity skills quarterly. Those sensitivity skills, that is, quarterly. We recognize that everybody, is not going to think or be like us, and we are
Hmm.
accepting of that. Look
Hmm.
at who we are, right? You know,
Sure.
who are we to think any other way, right? So, um, you know, how we embed that is, number one, me practicing what I preach. Being at the helm of the organization, and me
Hmm.
making sure that I hire leaders who believe in what I believe in and who's going to practice that, and make sure that we have continuing educational programs that's going to be able to teach our employees to teach to treat everybody from the 90-year-old to the 5-year-old who comes into our practice, because everybody deserves to be treated with cultural competency. We got to respect who they are culturally, however they are, however they present.
I love that. That's amazing. My next question will build from this, but are there any specific challenges that you'd be able to share with us that you faced when advocating for resources for our community? And when I say our, I mean the,
Can
less
I get off
fortunate
my
ones.
professional ladder? Can I say something?
Yes.
Child, please. Woo! What you talking about?
Come
Woo!
on now.
And it ain't over. It ain't
It's
over.
not.
Kenny,
It's
it's
definitely
not
not.
over. Man, if I told you my story, you'll start crying. Let me tell you something, brother. Let me tell you something. This is not easy. I mean, to the point to where when I was trying to open my practice, going to insurance companies, trying to get on their panel so that
Mm-hmm.
I can accept whatever insurance you got, to them telling me, no, we don't need no more your type of providers in this neighborhood. Kenan,
Mm.
I had to almost, I did almost, I had to threaten Cigna that I was going to go to their compliance office if they didn't look at the data. And the data that they had so many practices in the 60657, the Lakewood area code, and I had to compare that to the South Side area codes, and where they did not have enough providers. And for them to
Mm.
tell me that they had enough providers, that was crazy. So that was just one piece of it. And then, Kenan, you have to get credentialed. And when
Yeah.
you're messing with these insurance companies, they're extremely slow. So sometimes it could take 8 months to a year to even get credentialed. So you are trying to get on a panel, and you're trying to provide services to a group of people that need it in a community where all the healthcare resources have been pulled out. And so you would think that they would make you number one if you just put in an area code, I mean, a zip code where you know that there's a deficit, right?
Right.
Absolutely not. Absolutely not. And so from the going to the buildings to get a lease, I had to watch what I wore. I got on sneakers. You see this? I got on sneakers. I can't wear my sneakers. I have to wear dress shoes.
Yeah.
I can't dress like this because won't no owner of no building, they wouldn't take me serious. They wouldn't rent to me. And let me tell you something else. And I'm going to tell you this story because I don't want to talk to it because I don't like to talk about my past. My COO is white. There are a lot of times where I will allow her to go instead of me when I'm trying to rent a building.
Yes.
I'm very proud to announce that as of May the 30th, we have a new location that we will be open in the back of the yards. That will be our fourth location. And we're trying to bring healthcare to a different set of community. But I didn't have to go and, they actually came to me. But I'm going to tell you that when I'm looking at these zip codes on the side of town I'm on, I couldn't go. I couldn't go.
Right.
And so the first day that I walked in the door to go clean the building up, they'll ask me, well, how can I help you? Yeah, I'm the owner. You can help me.
I'm the owner. Wow.
So, Kenan, when I tell you that when you say barriers, I need you to understand that it's not over. It still happens and it still happens today. It's just how I choose to deal with it. I have
Yeah.
a set of people that I got to help. And my little inconvenience that I got to go through in order to get a building, in order to do what I have to do, and I'm going to call it my ministry. If I have to go through a little bit to get it, I'm okay with that. We had a
Right.
location out in Romeoville. Romeoville. I never forget it. And when people saw a lot of us going in and out the building, oh, the city, they just had a fit. They just had a fit.
No.
They just had a
No.
fit. I mean, they all type of code violations and all that. Ken and I don't talk about that. And you know why? Because it was the past. But the bottom line is it is reality. And
You
so
still face these challenges.
you still, you absolutely still. So when we talk about barriers, they're still there. But the difference is how you choose to deal with them. And if you're going to allow those barriers to stop you from reaching your goal. My
Hmm.
ultimate goal is to be a beacon of hope to people who don't know healthcare, people who don't know wellness. And so if God has put that on my heart, He didn't tell me that He was going to make it easy. He just said that He's going to make a path, right? He didn't
Right.
say that I wasn't going to have stumbling blocks or I wasn't going to have obstacles. So every morning that I wake up, I know that there's going to be something. But I surround myself with a great team who helps. And it's just what I have to do because I know trouble don't last always, as my grandmother
Come
used
on
to
now.
say.
It don't last always. Wow.
So those are some obstacles.
Right. Okay. I'm not gonna cry,
Uh,
but it resonated with me when you, especially when you said that in some instances it's better to send someone that doesn't look like you. And I remember situations that I've been in, even when we bought our first house. My realtor point blank told us, "Hey, you guys, my husband and there's a park around the corner. Why don't you go hang out there? Because I think the sellers may still be at home, and I don't want them to change their mind because you're black." And this was a cool white lady. I love her to this day. She shoots from the hip, right? But she knew the reality and she understood, and she's been in those rooms where that discrimination, and we'll call it what it is, happens. She's heard the conversation. So she was woke enough, I'll use that term. She was woke enough to have that moment with us and say, "You know what? I love you guys. I know this is your dream house. Hear me out." And we did it, obviously, and it worked out for us because when we were at the closing table and they actually saw us, we got a whole lecture about how, oh well, We were the only family that moved livestock into the city of Chicago, and there weren't people like you in our area. Like we got it. So she knew what she was doing, but it's those small inconveniences when you can clearly see the big picture that I think we need to remind ourselves of sometimes, because the struggle is not over. It's far from over. If we look at what's going on in the US right now today, we know it's far from over. But there are times where we have to step out of our comfort zone, or we have to make a small adjustment because we see that bigger picture.
Mm, powerful.
Yeah.
Yeah.
Yeah. So you have an upcoming event.
Mhm.
So the Melness um, event, it's actually a summit, I should say.
Yeah.
So tell our viewers a bit about the summit
Yeah.
and what to expect.
Yeah. So, one of the things what I wanted to do was to have an educational forum where people can learn and get more resources and, you know, about topics that affect us every day. Right. And so,
Mhm,
you remember you and I just had that aha moment, and you were just saying, what's different here is that we knew a little bit more about the resources. We knew a little bit more about where to go. Um,
mhm,
that's what this is for. And so we're going to layer that with speakers from our community on topics that are way beyond HIV and AIDS. Because I think sometimes when we bring LGBTQIA communities together, we just want to focus on that. But we still have issues with credit. We still have issues with crime. We still have issues with racism, with trauma, relationships, with religion. So this summit is going to have something for everybody, and
mhm,
and not only if that is it going to be that way, we're going to have renowned speakers who are going to speak on the topics, so that you can leave enriched, and you can not only hear the topics, but you can get the resources that you need. What we're going to do, Kenan, is that we're going to build on the summit, and we're going to have more after stuff afterwards. So I'm not going to spoil that by telling you all that good stuff, but the
yeah.
summit is going to be one part. But we're going to create a movement that's going to be able to face the times that we're getting ready, the geopolitical times that we're getting ready to go into. When we had our focus group, we did not realize how bad things were going to be. And so
Mhm,
the timing of this summit, the timing of the maleness movement is so ripe. And, our website is up now at www.melness, and melness is with three S's. We did that to have a conversation piece.org. But the bottom line is the goal is to be impactful, and that is our whole mission. And I didn't want to create something where you're just going to go and get lecture. So we're going to have
mhm.
fun. We're going to have fun as well, and so that's going to be a big piece of it as well. But it's going to be a community coming together for education, resources, and a good time. um,
I love that.
I was able to get Dr. David Malbrack out of Atlanta. He's going to be our keynote speaker. And this brother is so powerful. He is so powerful. I am so
Yes.
thrilled to have gotten him to be the keynote speaker. So he'll be joining us. We got Dr. Paula Barnes from Chicago, who's going to be talking about obesity in the Black community. That is so important. I think I'm speaking on a topic as well. And so we're just doing it, Kenan. We're just doing it. And I'm so proud to be hosting this event. And right now, our sponsors are there are everybody from Vive Healthcare to to little mom and pop organizations, and so we're doing a grassroots sponsorship program.
I love that. I love that. I'm excited about it. I will be in the building, of course.
Hmm. Hmm.
So I plan to get some good interviews and speak to some of the organizations that are there. So I'm excited. So,
Excellent.
if you're in Chicago on June 22nd, that's a Sunday.
It's a
It's going to be
Sunday.
at
I didn't
a
mention that.
Sunday.
It's a Sunday, but yeah, yeah.
Yes, it's going to be at Joe's Bar, and that's at 940 Weed Street in Chicago. Again, that's Sunday, June 22nd, 940 Weed Street in Chicago, Joe's Bar. Come out, have a good time. I mean, it's basically a health and wellness summit.
Yep.
It's the Maleness Health and Wellness Summit for the Black, gay, bisexual, and trans man community, which is phenomenal.
It's
Like
one of the first
phenomenal.
ones. It's one of the first ones.
Yes.
So it hasn't been done before. So I would be so disappointed if people don't show up. So I'm gonna tell you, I'm normally not disappointed, but I would be so disappointed because this is us. This is
Yeah.
finally us.
Yes.
We are able to show up and show out. It is our vision to take this to other cities. And so, but this is us. This is our opportunity to show up and show out and let people know that we do care about our bodies. We do care about wellness. We do care about our sexual health. We're going to be talking about some topics that you never hear, stuff that sometimes taboo you don't want to talk to about your with your friends about. We're going to be talking about those things, right? And so I'm so excited, Ken. I tell you, I can't wait. I can't wait. I can't wait.
Yes. I know that there are some pillars that the summit it's kind of built on. So I know mental and emotional health, physical health, and longevity, which
Hmm.
I cannot wait to hear about longevity because
Hmm.
I I've done an episode in the past on aging in the Black LGBT community, LGBTQIA community.
Hmm.
I would like to do another, but that longevity piece kind of touches me because I've always had older friends, so I've seen my older friends go through things, and I see a shift in the climate as far as care is concerned, and well-being is concerned, but it's not happening fast enough for the community that's aging now, if that makes sense.
Kenneth, this is such an issue. It is
Yeah.
such an issue. And I think we spoke about this in the focus group. I have so many patients who enter the later parts of their life. They've lost
Mhm.
all their friends because
Mhm.
their friends have died. And so, they're looking for friendship. They're looking for community. And
Yeah.
who do they go to? They go to people who victimize them. They go to people
Yes.
who take advantage of them. And it is so sad. And so when we talk about aging and resilience in this community, we got to be ready for it. And so and actually, I think that's the one class that I am going to teach. So
Mhm.
when we talk about this community, because I'm so passionate about it, I have a lot of aging patients. And one of the stories that hit me so profoundly is one of my older guys. He was at that time, he was about 75, 76 years old. And he had moved into a building and he had COPD. And
Mm.
he was in a building where his apartment was up like 6 flights of stairs, right?
Mm.
And if you know anything about COPD, you get short of breath. You can't walk.
Right.
So he had
Right.
that challenge. And then he had a relationship with somebody that was 30 years his, younger than him, that mean him no good, who only came
Mhm.
over when he got his check. I asked him, I said, you need more help. Do you want me to try to help you? Well, he said he was lonely. And he said that he just puts up with it because he was lonely. And so um, he later died. I never did get an opportunity to fully help him because
Mhm.
the resources just wasn't there. And the traditional places that you would send him to, he didn't want to go.
Mm.
He didn't want to
Mhm.
go. And so, what do we do for that community that don't want to go to a setting where they can get help, but they don't want to go? What do you do for them? And so, that's what we're
Yeah.
going to be talking about. And that is a challenge that we got to be ready for.
Yeah. Empowerment, self efficacy,
Those are all pillars.
um,
Yep.
social determinants of health, safety, and violence prevention, which I think is
Yes.
spot on.
Yes.
nutritional wellness,
Yes.
policy and political trends. I mean, literally the full scope of day to day life,
Day-to-day life.
and not focusing, like you said in the beginning, not focusing just simply on sex or HIV prevention. Like, we're more than a diagnosis, we're more than HIV. Like, why does that have to always be the narrative
You
when it
got it.
comes to supporting the community? We
You
need
got it.
help with so many other things, you
You got it.
know? So, I love what you're doing, and I'm so happy to be a part of it, to witness it. And again, I'm calling everybody that is watching or listening. If you are in Chicago on June 22nd, make sure
Or
you
you
are
need to
in the
come to
building.
Chicago. You need to come to Chicago. On our
Make
website,
it happen.
we're going to have the hotel information there for you can come to the event. So yeah, go ahead, Ken.
Make it happen.
Yeah.
Make it happen. So, let me ask you, do people need to reserve or purchase tickets?
So no, but we will have a registration link, or it should be up now on the website. And we are asking people just to register because this is good to know how many heads you're going to have in the building. But you don't have to. But we would like to know. So, Kenny, let me just tell you, one of the things that we are going to do is, you know, this movement. I told you I wasn't going to tell you, but I'm gonna get a little peek of it. What we're going to do after is we're going to go. We're going to actually take this into some research, right? And so when you say,
Yeah,
well, why you need this research? So we're going to ask people who are coming there to fill out this, this survey so that we can get data. People want to know, all right, they say, well, we can't be found. They say that we don't like to participate in research. They say that they don't know our needs because they can't reach us. They call us
yeah,
unreachable people, you right? And so
yeah,
we're going to be able to tell, we're going to be able to have it document what we feel, the needs in the community, and so on and
yeah.
so forth. And we're working on a evidence-based survey right now that everybody who comes will be able to take, and then we're going to build on that when we talk about creating this movement based on the research that we get from this event. I'm so excited about it. I'm so excited.
I love this. This
Yeah,
is amazing. For future leaders,
yeah.
the young generation that wants to make a difference or wants to uh, follow in your footsteps, what advice would you have to give them?
Mm. Don't give up. Don't give up. Particularly for those little boys or little girls who don't know their sexuality or question their sexuality, um, know that you won't always be where you are, um, and that you'll be able to live a life free of whatever you are going through right now, and don't give up. It's so easy to think that you're going to be like where you come from, and you don't see your future because of so much pain and so much hurt.
Hmm.
If there's one bit of advice I tell you, is to keep going on. Don't get wrapped up into any one person. And when I say that, I mean, mm, we think at a very young age that we're in love, and we allow that love and we allow those things, those emotions, to stop us from getting educated, to stop us from being our best. Because as we're young, we grow up and we're without it. So when we find it, we want to hold on to it. And sometimes it stops us temporarily from being who we need to be. Keep going. And if whatever or whoever you with don't want to go with you on your journey, dust it off. Keep moving. You got to keep moving. That's my advice. It's very simple. Very
I
simple.
love it, but effective. Switching gears a bit,
Mhm.
I got some questions to kind of dig deeper into you, Dr.
Mhm.
Mo, if that's okay.
Sure.
So, and they may be a little corny, but corny is sometimes good. I like corny on Black Gay Table Talk. If you could have any superpower for a day, and I know you have a lot of superpowers now that you're sharing with us, but any other ones, I'll say that.
It would be to make people healthier.
Healthier.
So you said, well, what do you mean? For the people who are entering the end of life stage, it would be to give them more life.
Mm,
We don't really realize how precious life is until we get to that stage. And if I had a magic wand, it would be to give them that opportunity to go back, perhaps to do something differently.
yeah.
So that would be one thing that I would do. I would do that all day long.
Mhm. Okay. Let me collect myself. Okay. um, yeah. It hits a little bit. I've seen so many friends of mine, like going back to Memphis, that are not here,
Mhm.
and I would so love to just have some more time with them. Well, this might be a good one. So, are there any hidden talents or hobbies that people don't know that you have that they might be surprised to know that you
Yeah,
have?
I can play some good basketball.
Okay.
Yeah, yeah,
For some reason, you look like you can hoop a little bit too,
yeah,
though. You
yeah,
look like you
yeah,
might be able to.
yeah. I can be on the court. Love it.
Okay. Okay.
That
Um,
would be one thing. Yep.
if you could wear a costume,
Mm-hmm.
any costume, every day for a full week, what costume would you choose and why?
It's funny that you asked that. It would probably be a clown.
Really?
Yeah, a clown.
I was not expecting that.
Yeah,
Why?
yeah. Because I could be goofy
Got it.
in my own skin, if that makes sense.
It
So I am, I like to have fun a lot, right? When you see a clown, you very seldom see a sad clown. A clown is always
true.
clowning around, and so um, in my own craziness, it would be a way for me to be happy all the time, clowning around.
Got it. I love that. Aw. Okay. What's the funniest or most memorable moment that you've experienced while working in health and wellness and doing what
Mm.
you do?
Let's just say you want to bring somebody that you just met to the doctor's office because you want to, you want to make them think you're doing something good, and it doesn't go the way that you think it should go. And so, to me, that's extremely funny because when you just meet somebody, you shouldn't be bringing them to your doctor's appointment, but you got some people who do that. So in healthcare, I see that a lot. Um, you
Okay.
know, People want to bring people that they just met to the doctor's office, and they forget that they gave permission for a person to sit there to go over history and all that good stuff. And it's very
Okay.
comical for a person to find out something while we're speaking, and I look over to the guest, and they'll be like,
Oh gosh.
so I've had a very funny incident. So that had to be one of the funniest incident, but I had to give you the context around. Let me tell people, if you go to the doctor, I'm so glad that you want to involve the person that you're with. But it may not be a good idea to bring, if you just met them last month, to bring them to your doctor's appointment after dating them for 1 or 2 weeks. You may want to wait a little while.
Just a little bit.
Just
Just
a
a
little
little.
bit. Yeah.
Got it. Oh, well, if you had one wish, a wish, a future
Mhm.
wish that you could put out there for the Black and Brown LGBTQIA community, what would that wish be?
Mm.
One wish.
You know, it would be to make the stigma go away.
Mm,
Um, it would it would be to make the stigma less, so that people would be okay with coming
yeah.
into care, asking questions, getting the services that they need without fear. without feeling as if they're doing something wrong. So I don't know how to make that happen per se, how to word that in such a way, but it would be, I want to remove the
Mhm.
stigma that's associated in this community, whether it's with HIV, whether it's with your sexuality, whether it's with whatever. It's to remove that, because that wall, that stigma, is what's preventing us from staying well.
I love that.
That stigma
Yes.
is what's preventing you from telling your straight doctor that you also are a same gender loving person. And so, because there's not a whole lot of LGBTQIA docs in this
True.
world. And so, you're going to no doubt have a doc who may not understand your needs, but you got to have that conversation so that you can talk about your wellness. You got to let them know your sexual preference so that they can make sure that you're STD
Hmm.
free, and that you're tested for HIV, and that you're tested for all the things that you need to be tested for when you're living a life where you just have to be just a tad bit more careful, if that makes
That makes
sense.
sense. I love that. All right. Well, I think we've covered a lot, Dr. Mo, and I know I've taken up your time. Is there anything else that you want to share or get off your chest before we end?
No, no, I just want to tell everybody to come out to the Melness event on June the 22nd. Just be there, come and meet me. I will be there. Just come and tap me on the shoulders and let me give you a hug, and let's do this thing. Let's show the people that we will be present, and we will be listening, and we will be dialoguing, and we will be coming up with some solutions.
All right. Well, family, again, we have Dr. Mo with us. Thank you for spending this time with us. You are truly amazing. And I think I speak for all of us when I say thank you for the passion that you have for not giving up. And thank you for being innovative in your approach to not only supporting us, but bringing us together and giving us more clarity on things that were not provided to us or made as easy for us to
Mm,
understand. So thank you for that.
mm,
And you're amazing. So
mm.
so where can we follow you?
Yeah, so I'm on Instagram, Dr. Mo Wellness, Dr. Mo, M-O, Wellness. I'm on TikTok, Dr. Mo Wellness as well. Um, and I'm on LinkedIn, and LinkedIn is Dr. Brownlee. So I'm at the Wellness Homes of Chicago. I'm at all the locations at least one day a week. So you can go to the website, and that is at www.wellnesshome.org. You can also now check out our page for the Melness movement, and that is www.melness, and Melness is with three S dot
I
org.
love that. Movement. The Millness movement.
Yep,
All
you
right,
got
Dr.
it.
Mo. I enjoyed you and thank you again for this time, okay? And we'll be there to root you on as
Thank
you
you.
continue to grow and expand and build this community of wellness and health consciousness. You're amazing.
From your mouth to God's ears.
Thank you.